Good afternoon, everyone. We'll start the meeting. Before we start the meeting, we'll have to do roll call. Whenever you're ready.
For committee members who are attending virtually on Zoom, when you hear your name, please unmute yourself and state that you're present. Please note, since you're attending virtually, your attendance will be marked, but it does not count towards quorum. Jonathan Martinez.
Present.
Thank you. Rosie Moda. Sylvia Gusto. Griselle Amador. Damian Andrade. Jalila Bailey. Joan Body. Esteban Chavez. Thank you. Maria Cruz. She was online before. Maria Cruz, if you're there, please unmute yourself. I'll come back to her. Nicole Wong. Cynthia Jeffers. Susan Parker. Joanna Romero. Pat Ruiz. And Kalina Sorma. Roll has been called.
Thank you. With that, we'll start the meeting. Our first presenter is from New York City Department of Health and Mental Hygiene. We are pleased to welcome the New York City Department of Health and Mental Hygiene, who will be presenting on oral health. The work focuses on education and raising awareness about oral health. With that, I'm pleased to pass it over to them, and the floor is yours.
Thank you so much. Okay, perfect. Thank you so much, Jonathan and Natasha and the rest of the team for having us to present at your meeting this afternoon. I'm just confirming that everyone hears me and everyone sees my slides.
Yes.
Okay, perfect. So my name is Sasha Bernard. I am the health education specialist at the Oral Health Program here in the Office of School Health, the New York City Department of Health and Mental Hygiene. And this afternoon, I'm going to be presenting to you Oral Health 101, some key considerations and the care strategies. So we have three main objectives for our presentation this afternoon. The first is we want to identify risk factors and preventive factors for dental disease. Then we also want to identify some links between oral health and general health. And last but not least, have an increased awareness of the available services and resources that you have access to in New York City. So I know we're few in number, but I do have a bit of interaction. I'm not sure if I'll be able to hear everyone, but when you think of oral health, or when you think about oral health, when you hear the term oral health, what is the first thing that comes to mind?
Prevention.
Prevention, okay. And one more person, anyone?
Yes, education about oral health.
Okay, yes, that's good, right? So let's look at what oral health is. So oral health actually refers to the health of the teeth, the gums, and that entire oral facial system. It includes not just the teeth, but also the tongue, the lips, and the soft tissue within the mouth. And it also allows for us to eat. It allows for us to speak comfortably, to smile with confidence, and to learn and to grow. So oral health is not just about one specific body part, but oral health is also very much related to overall health. So if we look at some of the most common diseases and conditions that impact our oral health, we have cavities, also known as tooth decay, periodontal diseases, which is also known as gum diseases. We have oral cancers and tooth loss. So we're going to look at some of those in a little bit more depth when we look at tooth decay. So what is tooth decay? What are cavities? So tooth decay is actually damage that is caused from bacteria. And when the bacteria eats away at the teeth, over time, cavities are formed. And these cavities are actually holes in the teeth, like literal holes. And signs of tooth decay typically include tooth discoloration. We can see here, the tooth has a brownish color, a blackish color. Sometimes it looks yellowish, having toothache, pain when biting, chewing, or eating, even when drinking something hot or something cold or something super sweet. And then again, as you see in the picture, having cracked or broken teeth. Now, there was a study that was done a few years back. So the data was from 2017 to about March of 2020, which looked at the prevalence of tooth decay by age group. And this was published by the National Health and Nutrition Examination Survey. So the results showed that more than 1 in 10 children ages 2 to 5 had at least one untreated cavity in their baby teeth. But by the age of 68, it was nearly 1 in 5 children. So that kind of doubled, right? And then by the ages 6 to 9, half of all of those children had cavities in their primary or permanent teeth. Now, moving on to the adolescent age group, 1 in 10 adolescents ages 12 to 19 had at least one untreated cavity in their permanent teeth. And then when we go to adults ages 20 to 64, which is the age group that I believe that we all should be in, 1 in 5 adults had at least one untreated cavity. Now, what we see from this is that while cavities are very common in childhood, it does go with you into adulthood. It's not something that only children are susceptible to. Adults, adolescents, older kids, all can have tooth decay, right? So let's look at gum disease. Now, gum disease is an infection of the gums that makes them swell and turn red. Very straightforward, right? But gum disease can lead to tooth loss and other health problems. So we see here in the pictures, gum disease is not just a typical redness. It's an over redness, right? That is very striking. And as I mentioned, it also involves swelling of the gum. Now, how do you get gum disease? So your risk for developing gum disease increases if you smoke or use any tobacco products, if you are over the age of 65, if you have diabetes or any other disease that affects the immune system, if you have poor oral hygiene, meaning you don't brush and floss as you should, and if you have a family history of gum disease, right? So the main risk factors for gum disease are these. However, it's not limited to just these things. There are other ways that you can get gum disease, but these are the main ways. And please feel free to stop me, ask any questions if you do have as we go along. So we are going to get into oral cancer, which, as the name suggests, oral cancer does affect the mouth or the throat. Each year, about 930 New Yorkers are diagnosed with oral or throat cancers. That's almost 1,000 New Yorkers each year are diagnosed with oral or throat cancers. Now, the risk for oral cancer actually increases with age, and the cases occur twice as often in men as women. So that means the two risk factors for oral cancer would be age, so a higher age, and 2, your gender, right, or your sex, which means that men are more susceptible to oral cancer than women. Now, oral cancer can spread quickly, so early detection is important for successful treatment. And oral cancer screening can be done during regular dental checkups. So it's really important if you do go to a dentist and they don't offer it to you, you can literally ask your dentist, like, hey, can you just do a quick screening for oral cancer? And that is something that should be able to be done without any issues. Now, oral cancer can have some concerning symptoms, which we will look at in the next slide, but it can also go unnoticed without any symptoms. So it's really important to get screened regularly so you don't miss something that may not be super prominent. Now, the symptoms of oral cancer are sores or discolorations in the mouth, lips, or throat, white or red patches inside the mouth that do not go away, numbness in the tongue or mouth, persistent throat pain or the feeling that something is caught in your throat, difficulty chewing, swallowing or moving your tongue, and swelling in the neck, jaw, or mouth area. Now, if you do experience any of these symptoms for longer than 2 weeks, you are encouraged to talk to your dentist or your healthcare provider, because some of these symptoms don't necessarily mean oral cancer. However, if they do persist for longer than 2 weeks, that's when it's something that you should take note of. And again, as I mentioned, you should be visiting your dentist regularly. That's once every 6 months, once a year at least. And in those visits, you should ask for oral cancer screening, even if you don't have any natural teeth. So even if you wear dentures, even if you have like maybe a top row of dentures, but your bottom row is natural teeth, regardless, you should be asking your dentist for these screenings. Now, the risk factors for oral cancer, the most common one, the one that anyone should be able to guess off the bat, will be tobacco. It is the most common cause of cancer. Cancer has been linked to the use of cigars, cigarettes, pipes, smokeless tobacco. And the good thing is that even if you are a smoker, have been a smoker, if you quit, you can improve your health. Quitting at any time can improve your health, even if you already have cancer. Another risk factor for oral cancer is heavy alcohol use, and also heavy alcohol use with tobacco use. That's a killer combo right there, no pun intended. Well, actually pun intended, right? Another one is the human papillomavirus, also known as HPV. It's very common, and it causes about 70% of mouth and throat cancers, which is why it's really important to have the HPV vaccine. And the persons are recommended to get it from a very young age. I believe the age is 9, right? Excessive sun exposure. So having too much sun exposure does increase your risk for cancer. So a good solution to that is to use a lip balm with sunscreen that can help protect your lips. And then last but not least, persons who have had oral cancer are at a greater risk of getting it again. So having a prior history of oral cancer is definitely a risk factor for oral cancer. Now, I did mention before that oral health is related to overall health. It's something that's often overlooked. You know, we think that oral health is a standalone, but that's not true. You can't be healthy overall without having good oral health. Now, we're going to look at some conditions that are related to oral health. Again, these are just some examples, not limited to. There are a lot more, but these are the 4 that we're going to look at today. So nutrition. So nutrition is actually a bidirectional relationship with oral health, where what you eat affects your oral health, but then your oral health also affects what you eat. So when you have poor oral health, it limits what you can eat. If you have a mouthful of cavities, gum disease, it's going to be really hard for you to eat crunchy foods like vegetables. However, if you have a diet that is very high in sugar, it can increase your risk of cavities and obesity. So we see it works both ways, right? Then let's look at cardiovascular disease. Heart disease and stroke have been shown to be linked to the inflammation, may be linked to the inflammation from bacteria or infection in the mouth, right? There are a lot of studies that show this right now, the link between cardiovascular disease and oral health. I just mentioned HPV, the virus can infect the mouth and throat, sometimes leading to warts or cancers. And as I mentioned, the vaccine does prevent against the types of HPV that can cause cancer. So that's a really great thing to note. And then last but not least, another bidirectional relationship will be diabetes, where the body is less able to fight infection, which can put gums at risk. But then having gum disease can also cause complications with diabetes. So again, it works both ways, where you just want to have good overall health so you can have good oral health, and good oral health so you can have good overall health. Now, I know typically oral health and diabetes is a very interesting one. Persons typically don't see the correlation between the two. So we just want to look at it a little bit more in depth here. So we see the cycle, right? Gum disease is an infection of the mouth. If you have diabetes, you are up to 3 times more likely to develop gum disease. But then gum disease can lead to higher blood sugar, which can lead to diabetes complications, which then makes it harder for your body to fight infections, including gum disease, and then we're back to square one with gum disease. So it is like a cycle that can be stopped, right? If we keep our mouth healthy and we have good oral health and we prevent gum disease, which is something we're going to look at next. But the two main takeaways for this would be that regular gum care can improve diabetes control. So if you do have diabetes, it's really important to take care of your mouth so as not to let anything progress to, any worsened stage. And then it's also important to let your dentist know of your health condition. You may not see it as being necessary to let your dentist know that, hey, I did bloods a few weeks ago and they came back where my blood sugar was high. You may not see the need to do that, but it's really important that you let your dentist know if you do have a diagnosis of prediabetes or diabetes or anything of the such. So let's look now at some tips for good oral health. Some of these are very straightforward. You learn them as a child, but it's not something that you should ever take for granted. So first of all, you want to brush your teeth twice a day. Ideally, it should be in the morning and night when you wake up, right before you go to bed. And you want to use a toothpaste that contains fluoride and a soft bristled toothbrush. Sometimes we think the harder the brush, the more likely it is for it to remove plaque. It's not the case. A hard brush can damage your gums. So you want to brush twice a day for 2 minutes each time with a soft bristled toothbrush as well as a toothpaste that contains fluoride. Then you want to floss daily. The spaces that are between your teeth or under your gums sometimes can be reached with a toothbrush. So that allows for the food particles to stay, which can cause cavities, gum disease, and bad breath. So we want to ensure that we floss daily. Then we want to eat healthily. We want to limit the number of snacks that we eat throughout the day and avoid sugary and starchy snacks. If we do have them, we want to ensure that they're eaten with a meal, not apart from a main meal. And then drinking tap water. So drinking tap water has a double benefit because one, being hydrated is very good for your oral health, it's very good for your overall health. But New York City tap water has something that a lot of other cities or even states don't have, and that's fluoride. And the fluoride in New York City's tap water helps prevent tooth decay. And I know recently there was a lot of controversy and conversations even about fluoride, but the levels in New York City tap water are safe, they're safe for consumption, and it is scientifically shown to have benefits, right? So we do encourage the consumption of New York City tap water. Then we spoke about all of the risk factors as it relates to gum disease, as it relates to cavities, as it relates to oral cancer. So we want to avoid tobacco, right? We want to limit alcohol because, as I mentioned, using tobacco significantly increases your risk for gum disease and mouth and throat cancer. But then also heavy alcohol use increases that risk as well, especially when used in combination with tobacco. So we want to visit the dentist regularly as well to help prevent diseases and catch problems early when it's easier to treat, and of course to get that screening done. Typically, a visit to the dentist should be once every 6 months. That's twice a year, but sometimes, depending on the state of your oral health, your dentist might say, "Hey, just come to have a checkup once a year." And then, of course, you want to ask your dentist about fluoride treatments. So you can ask about topical fluoride, which is like fluoride varnish. That is a coating that can be painted onto the teeth to prevent tooth decay. So we're going to look a bit more into those preventative treatments. We have 3 main ones. The first is dental sealants, which actually prevents 80% of cavities in back teeth. And the back teeth are where 90% of cavities occur. So that is a huge prevention strategy based on, the statistics. Then we also have silver diamine fluoride, which prevents cavities at a rate of 80%, but it also arrests existing cavities at a rate of 80%. And caries here is just another word for cavities. However, what this basically means is that silver diamine fluoride, it prevents cavities, but it also stops existing cavities from progressing any further. So it's really another great 2-in-1 combo. And then last but not least, we have fluoride, which reduces the incidence of cavities and slows or actually reverses the progression of existing cavities. And fluoride is available in many different ways. We see here it's being painted on the teeth, which is a varnish. I mentioned it being in water. There's fluoride in toothpaste. There's fluoride mouthwashes. You know, just fluoride exists in many different forms for you to use it as a preventative treatment. And all of these are non-invasive, safe, and very easy to use. And in New York State, there are actually different health professionals who can apply these treatments, meaning not just dentists. So we have dental hygienists, pediatricians, primary care physicians. So it's really important to know that so you don't limit your own access to treatments. So we're going to go into another aspect right now, which is more of the resources in New York City. So did you guys know that dental services are provided in over 1,100 New York City schools? Let me see a thumbs up if you guys know and a thumbs down if you did not know. Okay, I see some ups, I see some downs. Okay, so yeah, so actually the Office of School Health does offer dental services to all New York City schools at no cost to the schools, no cost to the families. And for a lot of families, this is a really useful service because access to care is a real challenge. So these school-based programs allow children to receive care that they may not have had otherwise. Now, all children can be seen, regardless of their insurance status, regardless of immigration. Once their parent gives them consent, they can be seen. So that's something really good to know. So I'm just going to give you guys some quick data. This year, we're looking at the column in green. The other columns are basically a comparison for other school years, but the column in green, last school year, we visited over 1,000 schools. Over 102,000 students did get their teeth screened and their mouths examined. But of those kids, 45% of them did have untreated decay, meaning they had cavities that had not been addressed. And 46% of those kids were actually referred to treatment to off-site dental services, which means that the issues that they had in their mouths were more severe than what could have been dealt with at school. So in schools, they do screenings, they do cleanings, they do fillings as necessary. They may apply fluoride varnish. But if a child's mouth needs too much work done, it has to be done outside of the school walls based on just, capabilities of the school's dentist. So 46% of those kids did need to see a dentist outside of school. We spoke briefly about sealants and fluoride. In the last school year, over 47,000 students did receive sealants and over 98,000 students did receive fluoride. Now, I know you guys are the Community Board 7. So what we did is we did pull some data from the schools within your district. So when we looked at those schools, we had just over 8,000 students that were enrolled. Just about 53 of them were consented. Now, as I mentioned, the program is an opt-in program. So parents do need to give consent to have their children's teeth seen, as opposed to some of the other programs like the vision program where the parent needs to opt out if they don't want their kids seen. So it works the opposite way. And one of the things that we've noticed is that consent is also one of the main barriers as to why kids are not seen, because their parents don't return the consent forms. So of the kids consented, which was the 53% of those enrolled in schools, 95% of them were examined, which is excellent. And just short of 4,000 students did receive fluoride. Just over 1,000 students did receive silver diamine fluoride. But there were 31% of kids who had untreated decay, and only about 49 students, did were classified as having urgent needs and being referred to a dentist outside of school. Now, one of the things that we focus on here in the oral health program is connecting persons to care. And we have two main ways that we go about doing that. The first is a New York City Health Map, which is something you can find online. If you just Google NYC Health Map, and you can look on it. There are a host of resources, I guess, for dental, not just for just dental providers, for a lot of other providers, STI testing, all of these things. But for dental services, when you click that, you can actually put in your zip code and find dentists within your direct geographic location, which is really cool, really convenient. Alternately, we have our list of low-cost dental providers, right? Which is what is seen on the right side. Now, this one, I mean, it's hard copied. We have soft copies available as well online as a PDF, but you have to go through and look for one that, you know, is close to you. Within Brooklyn, there are a lot of NYU Langone clinics that you guys can check out. Most of them, if not all of them, take Medicaid. They also offer a sliding fee scale. For those who may not be aware, that's based on your income. So you're not charged a flat fee, you're charged a fee based on what you earn, based on what your household income is. And a lot of them have specialties available. So children with special care needs, persons who may be pregnant, and you can get all this information by just calling one of the numbers on this list. As I mentioned, these lists are all low-cost dental providers. So they all take insurance, they all offer a sliding fee scale, and you can also get access to these by calling 311. You can just call 311 and ask for the list of dentists in Brooklyn, and you would receive this list, right? Another thing we like to do is to strengthen awareness. We talk about oral health, but if persons don't understand why oral health is important, then it's nothing. So we do have a lot of oral health educational materials, some of which we would have sent to your office. Feel free to have a look, but they target different audiences. We have things for kids, parents, persons with chronic diseases, teachers, early childhood, teens, just a host of different target populations with different topics that we focus on. We focus on diabetes, focus on nutrition, we focus on healthy habits, and available in a number of languages as well. So again, these can be ordered by calling 311. It can also be ordered directly from our office where you reach out to us via email, and we do send them to you. But as I mentioned, they are also available via PDF if you don't want to just have that, you know, for yourself or to share with your personal persons. If not, 311 or our office, easiest way to get them, multiple languages, and of course, no cost at all. Now, I am wrapping up. This is my last slide, but dental insurance, Medicaid, and Medicare, right? So to note, Medicare does not cover dental care, right? Medicare Advantage plans may provide for dental coverage, but it's really important that you check your plan carefully to determine if the coverage is helpful. So you want to look at what services are covered and who the in-network providers are. On the flip side, Medicaid does cover most dental care, and that includes preventative and treatment services. And again, if you're not sure if you may not even have insurance, you can call 311 to speak with a NYC Health Insurance Navigator and find out if you qualify for Medicaid. And this is also the website that you can go to from 311 that gives you information on financial counseling, health insurance, how to renew your insurance, and all of these resources as it relates to health insurance and dental insurance. There you can also just Google, I'm trying to see if I find it here, but online you can text Get Covered NYC to a number, and they can also assist you with insurance. But again, 311 is your best friend for all resources as it relates to dental care, oral health, and they can direct you as needed. So thank you very much for your time. Thank you again for the opportunity to present at this meeting. And I hope that you were able to take something away. I hope that you were able to you know, learn something new, and I hope that you would benefit from the resources that are available to you. Feel free to connect with us. This is the website that you can get all of the resources that I mentioned, the health maps, the low-cost dental providers, as well as the health education materials and the information on insurance. And yes, feel free if you have any questions, let me know. If you need to get in contact with us, the Jonathan and Natasha do, they both do have our contact information that we can be reached at. So thank you very much once again.
Thanks so much, Sasha. I'm gonna open the floor for questions, and we will need a microphone. Well, yes.
Just really quickly, my mom actually suffered a heart attack. Her teeth are not that well. My question to you is, she's since been having reactions to her heart medication. Is gum disease also, does it play a factor in resisting, I guess, heart medication or any kinds of medication?
Okay, so thank you for that question, and I'm really sorry to hear about your mom. I actually can't give an answer to that, because one, I'm not sure, and two, we try to not, respond to questions based on like personal stuff. But I will advise that you can probably schedule a visit with the dentist, and you can talk to the dentist to see specifically about that, specific medication, and see if there is any correlation between the medication and the gum disease.
Thank you. Anyone else, virtually or in the room? Go ahead.
Hi, Sasha.
Hi.
You mentioned regarding the statistics for schools and that there was a lot of times that children were not seen because the parents didn't return the consent form.
Yes.
I don't know if you can confirm this. The consent form for the health department, dental clinics and schools, is that consent form given to the parents in like different languages other than English?
So, I want to say yes. So how the consent form works, and I should have mentioned this as well, is that there are a number of different dental providers that offer these services in schools. A lot of them are outsourced, so it's not necessarily the health department that goes into the school. So we have NYU Langone, we have Columbia University, we have Smile New York, and each of them have their own consent form. It's the same basic structure, but they offer it in different languages based on, the population of the school and whatnot. So the option, yes, it does exist for them to be in different languages, but the dental provider is typically the one who determines, I guess, which languages that specific school does get.
Okay, I just had another question. Regarding the preventive treatment that you mentioned in your presentation. Now, based on like the dental sealants, the silver diamine fluoride, is it up to the dentist to suggest that for their patients, or is that something a patient can request, trying to be proactive about their own oral health?
It's both. So a patient can request it. I guess it would be ultimately up to the provider once they examine the mouth to see if the person is a good candidate for the treatment. But other than that, the provider does recommend that a treatment be done or be given. What we've seen in schools is that some parents do opt out of it. More than not, maybe they're just not comfortable because they don't understand what the treatment is. But typically, the dentist does recommend a treatment.
So, in other words, so the parents can opt out from the schools, but that doesn't prevent them from saying going to a dentist, like a private dentist outside of the school, to get their children examined and possibly get that type of treatment, like the
Correct.
dental sealants. Okay.
Yes.
Thank you.
Of course.
Thank you. I do have some follow-up questions. In terms of, so we know that Medicaid, the population of Medicaid will be shrink significantly due to the impact of HR1. One of the things that you mentioned is that a lot of the patients will be able to access treatment through Medicaid. It's two-tier questions here.
Sure.
First is what the department is doing in terms of like that specific population that will be losing insurance. And two is New York City Care Insurance will be taking this, or like what is the options for all New Yorkers that would like to access? Is this a possibility that they can get health treatment, oral treatment through New York City Care Insurance program?
So I would not be able to answer that because that's our department doesn't work directly with insurance in that way. So what I can recommend would be to call 311 because as I mentioned, they do have the insurance specialist on board and they should be able to answer that question way better than I could even imagine trying to.
And in terms of Medicaid, the Medicaid population is anything the department is doing to cover that specific population that will be losing coverage, or yeah, that's the question.
Right. So again, because we are the oral health program, we don't deal directly with those issues. And that's something that maybe I want to say maybe Healthy Asian Department or even those who work directly with insurance would be able to answer.
Another question. So you mentioned the school-based program. Is anyone available, like, is anyone able to get treatment, even if it's not directly like a father or mother or parent of any student at the school, or this has to be tied to the school for them to get this type of services?
So the students have to be registered within the school, and it's literally just for the student. So no siblings or no family members, whether it be direct or indirect, would be able to receive services. Literally just the children who are enrolled in that school at that time. And once they do enter this school and a consent is signed, they are eligible to receive services for the entire stint at that school. So until they graduate, it's not that they have to do like a new consent every year.
Got it. And in terms of promotion of these services at the schools that are like that have dentists at the facilities,
Yeah.
is there any type of promotion that the department is doing for them to know, besides letting them know that the services there? Is anything else that the department is doing to make the parents aware of this service?
Yeah, absolutely. So I guess it's kind of like a two-tier promotion because from our end, we promote to the principals and the schools so that we want them to, because they also have to request to have a program. So we promote to them. And then once they come on board, then the dental provider that they choose, they then do the promotion to the school, meaning the wider staff, as well as the parents. So different providers have different tactics. Some of them do like competitions between classrooms to see like who can come back with the most consent, and the class with the highest consent gets like a pizza party. Some of them we utilize like the robocalls. Some of them use the text blast from schools. We tend to utilize a lot of newsletters, and then also like in situations like these where we talk to community partners who can then relay messages to schools. But yeah, so it's kind of like a two-tier promotion. But as it relates to like speaking directly to families, the dental provider themselves typically do that.
Got it. And any school can request this service, or like do the department has like a threshold, or the specific program has a threshold, certain population or things like that that would
Nope.
be okay? Any school can
Yeah.
request that.
Literally any school. We have not all of the providers do like early childhood, but we do have some that. So we have early childhood, we have K-5, we have some D75 schools. So yeah, any school literally in New York City, charter schools, public schools, doesn't matter.
Got it. Thanks so much.
Yeah, sure.
One more question.
Yeah, sure.
But thank you for answering my questions.
Yeah, no problem.
Thank you, and thank you for presenting to us, and so that we can then go out into the community and
Sure.
maybe remind people about everything you've told us.
Thank you.
Do you track the schools that have not asked for those services? And if you do, what is the follow-up with them?
Yeah, so that's a great question, and also you're most welcome about the presentation. So yes, so we do have our data collection is very robust. So we have all of the schools that don't have programs, And what we do is we literally reach out to those principals like, hey, there's this program. It's no cost to you. It's no cost to the families. It brings great value to your school body. We use the slant of increased attendance, improving oral health will increase the students' attendance, and we kind of educate the principals as to why this program is beneficial. We do that via emails, we do phone calls, we present in different forums. Just a few weeks ago, we did a presentation to all of the health teachers and physical education teachers in New York City. So so our outreach kind of varies, but we do try to target the schools that don't have services, and also to understand why. Why is it that this is available to you and you may not be interested?
Just a thought came as you were speaking.
Sure.
If for whatever reason you're not getting a positive response from a particular school,
Yes.
and whatever, do you go to the superintendent of the district and ask for their assistance in maybe they know something that you don't know about why they're refusing, and sort of put a little heat, a little gentle pressure, and get a call from the superintendent, hey, what's going on? Can we help? Something like that.
Yeah, absolutely.
Not that I can imagine. I mean, but okay.
Yeah, no, we do that, and we also enlist the assistance from the health directors. So each school district has their own health director, and sometimes so we enlist them. We enlist the supervisor, anyone who can really help us. We do. Yes.
Thank you.
Of course.
Thanks so much. No online questions, virtual questions?
No.
Do we have any virtual questions, or we can move forward?
None that I see.
I don't see anybody online with questions. No hands raised.
Hi, Sasha. I joined. I don't know if there was any questions that you needed my help.
There were a few about insurance, but it wasn't for our office.
Okay.
Yes. Thank you.
Sure.
Thank you so much, Sasha, for that
All right.
presentation.
Yes.
Really interesting information and great to have you. Thanks so
No
much.
problem. Thank you so much for the opportunity. Have a good evening.
You too, Sasha.
Okay, bye.
Our next presenter will be Dr. Whitman, representing NYU Langone Health, the hospital Brooklyn facility. He's the chief of service for the emergency department at the hospital, and he brings extensive clinical and leadership experience and will share insights on smoking cessation. With that, the floor is yours. Hello, hello, hello.
Excellent. Thank you. So thank you very much for having me. I guess I just want to start by saying, yes, so I'm the Chief of Emergency Medicine at NYU Langone Brooklyn. We're your local hospital. We're extremely proud to serve this community, and we're available 24/7, 365 in the case of our emergency department for any of your medical needs. Tonight, I'm going to speak a little bit about nicotine, vaping, and what's up there is Juul. These days, there's less Juul, which is a specific brand, but there are a million brands out there, and we'll talk a little bit about their use. So just quickly, we have a program called the Prevention Education Partnership, or PEP, which goes into New York City schools. And also, we're happy to come and do talks to groups such as this, or any public health promotion groups, to try to teach sort of common sense and medically grounded information about drugs, alcohol, sex. We do a lot of that work, as I said, in New York City schools, but we're excited to be here tonight. So the idea behind this, and this is focused on adults, but also on sort of how to talk to children, teens about these topics. The idea is we want to try to keep people, but certainly our children and our teens safe, healthy, and ideally out of our emergency department, which was how this program started. So first, what do we know? So tobacco is a plant, which hopefully everybody is aware of. It's essentially grown. It is refined and dried and turned into a variety of tobacco products, from cigars to pipe tobacco to cigarettes to snuff and other oral tobaccos. And then also it can be further refined, or the chemical can be synthesized non-naturally to just isolate the nicotine chemical. So what types of products have nicotine in them? Well, you have what I think people typically refer to as nicotine replacement. So that's your Nicorette gums and things like that. These days, there's a lot of increased usage, of oral tobaccos. I don't know if anybody's been in a store recently. You've probably seen Zyn, very popular. It's all over the place, very popular among younger adults and unfortunately teenagers. And then traditional tobacco smoking has been on the decline for many years, but replacing that amongst adults, but also very much amongst teens and preteens, has been vapes or vaporizers. So the one on the right is the Juul, which actually is no longer legal and around, although they do still exist. It was for a long time the most popular one, to the point where teens would refer to this as juuling. It has mostly been supplanted by a variety of other devices. They all essentially do the exact same thing, which is that they vaporize a liquid, and that liquid gives you nicotine and unfortunately a variety of other chemicals into your lungs. So we talked a little bit about it. Essentially, what this Juul is doing is it's taking a liquid, it's running a heat current over it, and that heat current vaporizes the liquid, turns it into a vapor that you then inhale. And the reason why well, we'll go into the multiple reasons why that's a problem. But one of those chemicals that you see on the left is nicotine, which, as I'm sure the adults here in the room are all very much aware, it is an extremely addictive chemical. So essentially how all of these things work is very similar. It's a heat source, a battery, typically a rechargeable battery. Typically, there's a little light indicator. Sometimes they're fancy. They have ones that literally have video games that you can play on them, clearly not targeted towards adults. And then what they call the vape juice, which is essentially the liquid that gets vaporized. And then what's in this stuff? So what's within that juice, a large proportion of it is nicotine, but it also has a stabilizing chemical to keep it in a liquid form. Most typically, that's propylene glycol, which you probably would guess is not great for your lungs, and it's not. And also some glycerol. And then there are a variety of flavor additives that are used. There's strawberry and mint, and they run the gamut of any flavor you can imagine. And again, the challenge here is, unlike a cigarette, which I mean, I think most people would say the smell is not particularly exciting. And most people would say that the first time you inhale it, if you ever try one, it's not like, wow, this is the greatest flavor ever. If you're inhaling grape soda flavor, unfortunately, that's something that may be a little bit more appealing. So just to sort of level set, one Juul pod was equal to an entire pack of cigarettes. And so the disposable vapes sometimes can be equal to 5 or even 10 packs of cigarettes. And so, kids or adults that sit there and sort of puff away at a Juul pod all day can really not, or another vape, cannot really understand just how much nicotine they're getting. And it's actually much easier to take in a much larger quantity of nicotine than it is with traditional tobacco delivery. And the biggest challenge there is it's much more easy to get addicted much more quickly. So again, Juul pod is an entire pack of cigarettes. So how does nicotine work? Essentially, your brain, your whole body has nicotine receptors. It is a naturally occurring neurotransmitter. And so when you take it in, it is a stimulant. It constricts your blood vessels. It increases certain signals in your brain. And also, as you become more and more used to it, as you become addicted to it, it becomes a negative feedback loop. So it starts as a positive feedback loop. You take in this drug, and it makes you feel good. It makes you feel activated. It makes you feel up. And then after a while, what happens is if you don't have the chemical, all of a sudden you feel down until you get it, and then you feel back up. And that essentially is the pathway that addiction forges in your body. So essentially, it upregulates a lot of your fight or flight responses. and it causes your heart rate to go up. It causes you to breathe more quickly. It causes your pupils to expand. So we talked a little bit about this already, but essentially, in addition to the direct effects to nicotine, what happens is it feeds your dopamine receptors. And this is true for essentially, well, almost every addictive chemical. Essentially, you take in this chemical and your body gives you a little reward. You've given your brain the thing that it is asking you to give it, and so it gives you a little dopamine. Thank you for giving me the thing that I'm looking for. The challenge with that is it's a self-reinforcing cycle. The more you do it, the more you rely on that dopamine, and then your dopamine levels get calibrated to the point where without it you feel terrible and you want more and more. Exactly right. Okay, the challenge with nicotine in the developing brain is these pathways are still growing. The human brain is still growing until you're around 25 to 26 years old. And in a young adult or a teenager, these pathways are much more susceptible to being rewired and permanently rewired by these addiction pathways. And unfortunately, once you get addicted to one substance, your brain sort of learns how to become addicted to substances. So this really is a big deal. It's obviously not good for anyone to make these decisions, but ultimately, look, if a 35-year-old decided to pick up vaping, I would tell them that that's a poor choice, but they're adults and they can make their own decisions, hopefully informed decisions. But in the case of children and teens, it's that much more important to talk to them about these things, to make sure that they're not using them, because ultimately, once they start down these paths, it's extremely difficult to wind back and go back to the place where you weren't using drugs, and in this case, nicotine. So who's using these things? What percentage of teens does anyone think uses vapes, nicotine, or Juul? As of, and I have a stat here, and I actually have an updated stat that I'll share. But what percent do we think use? Now, these are national statistics. 45%? Anyone else? 50? 50? So we're lucky because we're not there. That would be pretty terrible, and I'm happy that it's sort of top of mind and people are concerned. You do see a lot of it, and so it's conceivable first that these numbers are a little underreported, but also this is I should have specified this is regular use. So there are kids that might try it once or twice, and I think unfortunately those numbers are higher. And it is true that in some communities the numbers are higher, but nationally, as of 2022 or 3, the number was 17%. In 2025, the number actually fell to 14%, but it's still a significant number. And keep in mind, none of these people can legally purchase these things, right? This is all straight up illegal use. And so it just shows you how pervasive an issue it is that 14-year-olds can get their hands on it pretty readily. And I recognize that, if you walk into a bodega, you're going to get carded, which is a good thing. I certainly hope in every bodega in New York City, and I would assume. But the reality is they're still falling. These devices are on every street corner. You can walk half a block in any direction and you're going to be able to find these things. And so it's just that much more imperative that we speak to everybody that we know, children, adults, about this issue. So why do teens Juul? When they're asked, they like that or not just Juul, but use vapes. They say the flavor tastes good. A lot of teens think it's harmless. They say smoking is bad for me, but it's just vaping. How bad is it really? They want to try something. It's readily available. Experimentation in children is common, but again, we have to make sure that we're talking to our families and our friends about the fact that they're not harmless. They're harmful, and they shouldn't be considered as like, oh well, I know my parents told me cigarettes are bad, but Juul's no big deal, or Elf Bar or any of these other products are no big deal. So I'm sure some of you remember these ads. I know I do. There was a time when tobacco ads were essentially pretty clearly geared towards children, towards teenagers, towards younger people. Thankfully, those advertisements have largely been curbed. Things have changed. We don't see the same kind of tobacco advertisements that we used to. I mean, I remember I'm a big tennis fan, and I remember when the big tennis tournament in New York City was the Virginia Slims Championship, which is kind of crazy to have, cigarettes sponsoring a sporting event. But this used to be common. It's thankfully not common anymore. But I just want to call out that if you go around and you look at the display cases and the advertisements for vaping, you will see ads that resonate with children and teenagers, and it is just not regulated to the same degree that tobacco ads were. This was in subways in New York City not too many years ago, and this is still the kind of advertising that you see aimed towards children to try to get them hooked on these vaporizers. I would add that the major tobacco companies are some of the big investors in some of these companies. So there's a lot of targeting on social media. You will see, if you look on Instagram, on TikTok, a lot of vaping going on. And the reality is people are paid to place this stuff in front of our kids. And it's just, again, I don't think anyone in this room necessarily is in a place to change that, but we are in a place to talk to our teens, to talk to young adults about the fact that this is going on and the fact that they're essentially being manipulated for someone else's profit. So how do they get it? Unfortunately, some do buy it in stores. I can't say that there's 0 stores that sell to underage people, although I think that's thankfully pretty uncommon in New York City. People get them from friends and family, and unfortunately, there is a massive market on the internet where it is just not difficult to purchase these things, and it's shockingly easy to get your hands on these devices. So what are the risks? We talked about the general risks, a tolerance leading to dependence and addiction, and then withdrawal, then reinforcing that addiction. But in addition to that, excuse me, there are some other specific risks of vaping that we'll talk about. But this is an important stat. 3 out of every 4 teen smokers continue into adulthood. If you become addicted in your teen years, it is just not easy to just stop on a dime. And tobacco companies know this, vaping companies know this. They know that that's the time to get people hooked. Again, there are just not a lot of 35-year-olds who walk down to the corner store and say, I'm going to start smoking today. It's not a common thing. And so we really have to work on this in people of younger ages. So the short answer on the risks of vaping specifically is we don't know exactly what all the risks are because it's a relatively new technology. I hate to call it a technology, but it is. And so we don't really know statistically how much better or worse it is than tobacco smoking. What we do know is there's a lot of emerging evidence that some percentage of people that use these products, apart from becoming addicted, are going to have really serious consequences. This is an actual photo of a patient who had what's called vaping-associated lung injury. They call it VALI. Essentially, there are a few different ways this can happen, and it's a really, really serious problem. So this is a vignette of another actual patient, an 18-year-old girl who had a history of mild asthma, who came into the emergency room with chest pain, shortness of breath, difficulty breathing, and cough. 3 weeks prior, she had started vaping an e-cigarette. Her chest x-ray showed what looked like pneumonia. She got antibiotics, but she got worse, and her lungs started to fail. She actually ended up being admitted to the ICU. She was placed on life support for 5 days and was eventually discharged with severe lung inflammation due to vaping. The issue is that some of the chemicals in these vapes, sometimes just because some people naturally react in a very inflammatory way to these chemicals, can cause severe permanent lung damage. In addition to that, there's a lot less quality control. If you buy a pack of Marlboro cigarettes, for the most part, you know what's in them. If you buy a vaporizer from the corner store, the reality is the liquid in that vaporizer was made potentially in some random factory in China that makes chemicals, and you don't know what necessarily is in it. And so there are multiple case reports of people vaping all kinds of horrific chemicals, heavy metal poisonings, really bad problems, because ultimately the quality control on these vapes is much less because they're sort of gray market. A lot of them are unregulated. A lot of them are coming over illegally. In fact, there's I believe it's called Elf Bar is one of the most popular ones that you see around. They're fully illegal. Like, you can't import them. They make them I believe they're made in China, but they were legal. They were made illegal, but they're still everywhere. And so you have to ask the question, if it's illegal for import and it's coming into the country, how do we know if it's even an authentic vape, right? You have no idea what's in these chemicals. And so essentially it becomes an unregulated drug, and it can cause real problems. Now, apart from that, the risks of vaping generally, asthma, heart attack, stroke, a lot of the same risks of tobacco are being seen with vaping. Again, it's not totally clear if you vaped for 20 years versus smoking for 20 years and you had a regulated vape, whether it would be slightly better or slightly worse. But to be clear, there's no question that all of the same issues that happen with tobacco smoking are associated with vapes. Vapes absolutely have carcinogens or cancer-causing chemicals. There's another misconception. Well, if I smoke cigarettes, I can get cancer, but if I smoke the vape or I vape, I'm not going to get cancer. It is a proven fact that all of these vaporizers, in the way that they vaporize the liquid and cause the emulsion to turn into vapor, they all have these cancer-causing chemicals in them. So what do? The biggest thing to do is talk to kids about vaping, talk to teens about vaping, talk to them about it in the same way that you talk to them about tobacco, in the same way that you talk to them, hopefully, about alcohol, in the same way that you talk to them, hopefully, about cocaine and heroin and all the things that are out there that we need to make sure they understand. Now, again, I think roughly 20% of kids have tried it. 20% of teens have tried it. I'm not advocating for the returning to the 1980s of just say no and all drugs are evil and you can't ever do anything. But on the other hand, I think we need to arm teens and adults with real knowledge. We need to tell them what the actual risks are and how bad these things actually are for you. And then, unfortunately, they are going to make their own decisions, but we just do need to make sure that they understand that these are not benign, that they're designed to get them addicted. They are marketed to them as a product because they want you to get addicted and use them. And I think it's an important message that we need to deliver forward. The other important thing, obviously, is modeling the right behavior. Any adults in the room, if you smoke, if you use tobacco products, if you have family members that do so, I would urge you all to quit. The last presentation had an important point, which I will double down on, which is quitting today is a good choice for the rest of your life. I don't care if you smoked for a week, a month, a year, a decade, or 50 years. If you quit today, your life is statistically going to be longer and healthier. And you're going to immediately decrease your risk for cardiovascular problems like strokes and heart attacks, and your risk of lung cancer and emphysema. The minute you quit, you start to get healthier. And while it's true that sometimes some damage is done, and I understand there are people who have that sort of fatalistic attitude of like, well, I've already been doing it for 30 years. What's going to change now? It does change. It changes immediately when you quit. And so I would tell you, if you want your teens to quit, talk to your brother who smokes in front of your teens. It really makes a difference. I'm sure everyone knows this. I've got two kids. They don't listen to what you say as much as they see what you do. And that goes for you and it goes for everyone that's in their sphere. Very important to talk to teens and to anyone who smokes or vapes, and talk to them honestly about your concerns, about the reality behind these chemicals, about how to get better and to quit. So helping them to quit is really important. People need support. Love and support from people that care about you is the easiest way to push people forward into quitting. People that feel like they're alone in it, people that feel like they don't have support, people that feel shame to talk to their family members about this stuff are less likely to quit. So I would encourage, certainly with teens, but with anybody, to be open and honest, but also to be supportive and loving in these issues. Especially adults that have smoked for a long time, people feel shame, people feel uncomfortable, and they shouldn't, because nobody's perfect and we're all trying to better ourselves. And supporting people to help them quit is one of the most powerful things that you can do for the people that you care about. There is a New York City quit line. There is national help through thisisquitting.com and that number 706-222-QUIT. I think it's formerly known as the Partnership for a Drug-Free America, now known as Truth, has resources, and New York City actually has really robust resources for nicotine replacement therapy for those people who are already addicted, so that you can actually get cost-free patches and gums and things like that while you move towards quitting. And then just a quick shout out, we also at NYU run the New York City Poison Control Center. If anyone ever has concerns around household items or drugs or alcohol, or you get something splashed in your eye, or someone has a drug and you're not sure what to do, 212 Poisons, 24/7, 365, free service. We're happy to help answer any of those questions really in real time. I think that's all I had. I'm happy to answer questions. And I just will again say both thank you for having me, and also we are really very proud to serve this community, and we hope to not see you in the emergency department maybe, but see you at NYU Langone Health.
Thanks so much, Dr. Whitman, for that great presentation. With that, we will open it for questions. And go ahead.
I know that NYU offers a lot of, what do you call that? Not just preventative, but studies. Are there any studies on birth defects as they pertain specifically to vaping, how it affects children or the mother or even the dad, and how that can contribute to birth defects?
So it's a great question. I would say, so first of all, to answer your question directly, I'm not aware that NYU is doing those studies right now, but there is ample evidence that all tobacco products and nicotine-containing products do lead to increased what we call teratogenicity, which is just the word for birth defects, or the ability to cause birth defects. There's no question. I think the data is out. There may be additional studies that I'm not aware of that are ongoing to determine sort of the degree, but there is no question that all of these chemicals absolutely do lead to birth defects and also to low birth weight in infants, without question.
I was having a conversation. I was part of a group conversation, and it was all women, and I was the only person who was older than 40, and I'm way past that. So everybody else was between, I want to say, late 20s and 40s. And one of the women said, I need to vape a little bit. I'll be back. So she goes to the corner, and then a conversation sort of started with the people who were, and a couple of them, and these are college educated people, current, two of them mentioned something about, have you heard, let me see if I remember, have you heard that, vaping can be used as a birth control? And I stood there and I said to, wait a minute, did you just say that? And yeah, there's things on the internet and everywhere. Well, the fact that it's on the internet doesn't, 50, 50 this, 50 it is, 50 it isn't, right. I was shocked. Had it been 14-year-olds, 13-year-olds saying that, I was like, cigarette would help you lose weight. That was the other one from my time. I remember that all the time. And black coffee. As long as you drank a lot of coffee, of course, you're going to shake like anything. But so what do you know if this is something that is a thing?
So objectively, it's not a thing. In other words, so just to be clear, there's no evidence that vaping is an effective method of birth control. I would say it's a great story because it illustrates how important it is for people to speak up and for people to take the knowledge that they gain here or anywhere and educate their friends and family members. And the reality is I'm here talking, but me or other physicians can't be on every corner, can't be in every conversation, right? It's incumbent upon all of us as citizens to help each other with the real information and the real knowledge. So it is definitely true that there's a lot of misinformation out there about, I mean, health in general, but certainly about vaping. And I think it's important that we make it clear, you know, again, this is an adult person who went off to vape, right? So she has every right to make her own decisions, and I wouldn't tell her that she couldn't. But on the other hand, if somebody said to me, oh, and by the way, it's a means of birth control, well, hold on, it's not. And if somebody said, well, actually, it's perfectly fine. Well, just to be clear, it's not. Like, you can make your own decisions, but it's not good for you. It's actually quite dangerous for you, much like all other tobacco products, smoking, et cetera, are bad for you. So I think, to me, that story illustrates how important it is that we all sort of speak up and talk to the people who we care about and tell them the real truths.
I remember when my son was in junior high school and high school, way back when, that for PTA meetings, both for hard drugs and cigarettes, the police department had a specialist who would go to PTA meetings and present to the parents about what the latest, what was available outside that school, so that parents would know. It doesn't matter whether it is what used to be a bad neighborhood, or it could be the Upper East Side, and what the words were. And he had a kit where you could go and smell for this. If you go into your child's room and you get a whiff of this, you turn that room upside down. It is your house. It's not your child's house. And he was a tall, brawny man. And, it was like when he talked, you listen, type of thing. I have told principals in the same and parents, ask for that. A couple of principals, we never heard about the police department doing that. It's
That sounds a lot like a program that used to exist called DARE, Dare to Keep Kids Off Drugs. The police department used it. There were good things about DARE. I will say that I think the challenge is that it wasn't, it sometimes, in my estimation, maybe moved a little bit too much towards the scare tactics and away from the science. And so that's why we started the Prevention Education Partnership, and why we've lectured to thousands of New York City school kids, because I think having it come from physicians instead of police officers might be slightly less scary or confrontational for students. And also, we want to make sure that every single word that we say to them is grounded in the latest real science. Now, I will say the other point you made of making sure that parents are aware of what's out there is something that we all need to do a good job of, and it's something that the police may be able to do a good job of. I do think that when it comes to educating students and parents and the community about drugs, I feel pretty comfortable saying that I think having physicians do that is a really great, it's in our skill set. It's a great part of what we can and really should be doing for the community. It's why I'm here tonight. But yes, I think it is important for parents and everyone in the community to understand, the risks that are out there and what their kids are being exposed to out in the world.
Hi, yeah, thank you.
it's not happening. I'm telling you, because I go with a lot of parents to see, because I'm retired now, I have the time to help them put together a 2-page. If you have 2 pages of questions, show up with your, and the doctor goes, oh, well, I said, no, I need answers, So that's what a doctor is supposed to be doing, I think, but it's not happening. It is not happening. And the parents need help. Definitely. I mean, and I believe it's the role of the school, or the medical association in Brooklyn has one, the Brooklyn whatever, and that is something. And I don't see, who's the Department of Health. I mean, hello, but I'm asking you because maybe you know that. Oh yes, you pick up a phone and you call this or the principal does and says, I need somebody from the Department of Health to come here for the next PTA meeting or whatever.
So I don't know that the Department of Health has that service, but again, we do, the Prevention Education Partnership. And so if you know of a school that wants us to come and present, we can make that happen. Especially if it, if it's the larger the gathering, the better. We'd love to hit a big PTA meeting. And also we'd love to continue to organize in additional schools. The other thing I didn't mention that the Prevention Education Partnership is doing is partnering with New York City schools to actually get naloxone, the antidote for opioids like heroin and methadone, et cetera, into New York City schools to make sure health teachers have it. They know how to use it. We've trained hundreds of New York City school teachers on that as well as here in Sunset Park at Sunset Park High School. So happy to continue to partner with essentially anyone who feels like we're of use to the community, for sure.
Follow-up question on that. If any school is interested in hosting you or someone else from the Prevention Education Partnership, how can they contact you?
You can email me and I'll put you in touch with our PEP team and we'll set something up. Absolutely. If there's a school in this community or any community in New York City that's looking for what we call a pep talk and or naloxone training, that's something that we can provide.
I have a question regarding the coming to local schools.
Sure.
Do you have a flyer that kind of states, hey, you want us to come to your school to give a presentation? Because then we can include it in a future newsletter.
I don't have it on me, but if you email me, I'll get it to you. Absolutely.
Yeah, we could include it in our next newsletter in mid-June.
Absolutely.
I mean, July, sorry,
Yes.
going to July.
For sure.
Thank you.
I'll make sure to email you for the flyer.
Please.
Maria Cruz, one of our committee members, has a question. Maria, you should be able to unmute yourself now.
Yes. So all this information is great. And also, our president just a few days ago said that e-cigarettes are 95% safer than regular cigarettes and that they will help you quit. And our FDA just approved again using fruit flavored cigarettes. And when I went on the FDA website, the language is really not good. So like if a family is trying to tell their kid, this is terrible, and you go, and I've seen this in many other different government websites where they're removing research or they're putting a banner across it, like with the vaccines and autism, and it's saying this is unproven. And so I guess my question is like, what is the response to that when if a kid just goes and Google's is this safer, the first thing that comes up is the FDA, the president's quote, and the actual words are, yes, it is safer. Like what is the move there for communities?
I'll look into the camera. So for a second, when you said our president, I was thinking the council president, and I was like, really?
No,
But
President
you're talking about
Trump.
the presidents of the United States.
Yes.
Oh boy, I don't even know where to start. I mean, look, I guess what I would say is science is real, and we should trust what it shows us in an unbiased and honest fashion. And I took an oath to first do no harm and also to follow science to try to help humanity. And I think it's pretty clear, based on all the data, that vaping is bad for you. And it's pretty clear that the flavored vapes are specifically designed to hook teenagers. And so were I in charge of HHS or the FDA, I would not be doing those things. I would respectfully disagree with those positions. I think the answer is we need to talk to our kids, just as the president of the United States might say something else that we don't necessarily believe to be factual or right. I think no matter we have to present data. No one is infallible. No one is always right. And ultimately, the way to disprove an untrue statement is through data. And if you go to scientific websites, if you go, there is a repository of every scientific study essentially in the world called PubMed. If you go to PubMed and you type in vaping harm, I promise you, you're going to see 1,000 studies about how it's bad for you. I'm not particularly interested in litigating whether it's 5% better or worse or 20% better or worse than tobacco. That's like saying, is it better to get stabbed than shot? It's not good for you. It's not good for teens. They shouldn't do it if we can avoid having them do it. Their lives will be healthier in the absence of the use of these products. Full stop. And so that would be my hopefully less long-winded to my child retort to that statement.
Thanks.
The question. So in the presentation, you mentioned that the national average is 17% of teens who are vaping
Right, regularly.
regularly.
Mhm.
Are there statistics available like in New York City wide? And
There may be. I bet there are. I think the more local the statistics, the less reliable. But those statistics, I'm sure the Department of Health tracks them. I'll be honest and say I don't know them, off the back of my hand. But I would anticipate that if anything, they're unfortunately maybe a little bit higher.
okay.
But regardless, the right number for teens using vapes and tobacco is 0. They ought not to be using these things while their minds are developing and they're insufficiently mature to make the decisions whether they want to take something that they're like 3 out of 4 of them are going to get addicted to.
Thank you.
I do have some questions. Can you talk more about the relationship of marijuana became legal not long ago? Did you see any patterns? Because when things move one way, things to move the other way. So can you talk more about that? And if you see any patterns in terms of like switching from consumption of tobacco to consumption of marijuana?
I think I think it's a little different. I think that, marijuana is a much more mind altering substance than tobacco. Tobacco is sort of a mild stimulant. And so ultimately, I think the people that are using tobacco are more like people who are using caffeine. The challenge is that it's outlandishly addictive once you start down that road, and also that the delivery mechanisms are pretty bad for your health. I would say, marijuana legalization writ large, we haven't seen a massive explosion in usage. I don't have the exact statistics, so I don't want to speak too much out of turn, but I'll say I have not seen a massive spike in emergency department visits. We have seen somewhat of an increase, and I will say, without going too far off on a tangent, we have seen an increase in something called cannabinoid hyperemesis syndrome, where essentially people come to the emergency department with excruciating abdominal pain and nonstop cyclical vomiting. And that is something that can happen to people that use especially very high doses and large amounts of marijuana. And it's something that we really hadn't seen before. And also, marijuana has become more and more potent over the last, I'd say, 20 years in a pretty linear way. So, if you were to take one puff of a marijuana cigarette 20 years ago, you probably would have to take 20 puffs to have one today. They have cultivated the plants and concentrated them in a way that they're much stronger than they used to be. And I do think that there are some associated dangers with that. That said, marijuana typically, thankfully, is not as dangerous a drug as some of the others, i.e., cocaine, heroin. We don't see overdose deaths and things along those lines. So, it's complicated. I think for adults, drug use is a much more nuanced and complicated subject. I think when it comes to teens and children, it's a little simpler as far as what the goals ought to be from a governmental standpoint and from a parenting standpoint.
Thank you. Another question. So we did notice that this year in Albany, there was a significant movement in terms of like taxing nicotine. Can you talk more about the effectiveness of this type of tax and your opinion about it?
All right, so I'm going to take off my work hat for a minute and have a personal opinion, not sanctioned by NYU Langone Health. I have real concerns personally around what are termed, quote, sin taxes, because I feel like they're quite regressive. If you are a rich person, a $12 pack of cigarettes versus a $10 pack of cigarettes probably doesn't really affect you very much. If you are living at the poverty line and you happen to be addicted, in some ways, I feel like we're penalizing people for it. Now, you know, if and when all of that money goes directly into drug treatment and free tobacco replacement therapy and all that other stuff, then I think it becomes a little bit easier. But unfortunately, you know, we saw this with the so-called big gulp tax many years ago. My own personal take on that is that I worry that sin taxes are very regressive taxes, that they hit working poor people the hardest. And I'm not sure that they're as effective as, I'm not sure the data shows they're super effective at doing anything other than hurting people financially. At some point, they become effective, right? If it's a pack of cigarettes were $10,000, nobody would buy them. But I'm not sold that that's the way I would personally approach it as a policy. But again, I want to be clear, that's not like a sanctioned official opinion or a medical one.
Thanks so much. Any other questions online? Any other questions with public? All right, thank you so much for the presentation. It was really, really interesting to see all of the effects, and I really appreciate it for your time. Thank you, Dr. Whitman.
Pleasure. Thank you.
With that, we will be concluding our meeting. Thanks so much, everyone online, and thank you, everyone, today for coming and showing up. This is the last meeting for our for this year, at least up to September, until the summer break. Thank you, everyone, and enjoy your summer, and have a nice day, and enjoy the rest of your night. Thanks so much.